You're in a doctor's office. Your body isn't working the way it used to. Maybe your legs feel weak, your speech is slurred, or you're having seizures out of nowhere. But your tests all come back normal. You're told there's nothing neurologically wrong. But your life says otherwise. Let's become more aware together. There's a condition that affects thousands every year. It can mimic stroke, epilepsy, multiple sclerosis, even dementia. But it's not caused by structural brain damage. It's called functional neurological disorder, or FND. And despite it being one of the most commonly seen conditions in neurology clinics, it's also one of the least understood. Roughly 1 in 3 neurology clinic patients have at least one FND symptom, and yet diagnosis is often delayed, misunderstood, or missed altogether. So what exactly is FND? FND can show up as limb weakness or paralysis, vision or hearing loss, seizures that don't show up on EEG, speech issues, tremors, fainting, numbness, and even GI problems, fatigue, brain fog, or pain. And it's not just stress, and it's definitely not made up. It's a real dysfunction in how the brain and the body communicate, especially when it comes to movement and perception. Think of it as a glitch in the software, not a glitch in the hardware. We know that FND is more likely to affect younger people, women, and those with greater disability across their lifespan. A meta-analysis of over 30 studies found strong links between FND and stressful life experiences, including emotional neglect, physical and sexual abuse. But here's the twist. FND isn't caused by trauma alone. It's not even necessary for trauma to be present. And that's part of what makes it so misunderstood. Multiple factors like life stress, medical experiences, and beliefs about illness itself can all play a role. And here's where things get heartbreaking. People with FND often undergo years of unnecessary testing, surgeries, and medications. Because why? Well, no one's ever given them a clear, confident diagnosis. Worse, some are told it's all in your head. Others are prescribed wheelchairs or opioids when what they really need is understanding of a new kind of care. And sadly, believing the condition is permanent can actually make recovery harder. And it's not because people are faking it. It's because beliefs shape behavior, and behavior rewires the brain. Here's the big reveal. FND is one of the clearest examples of how mind and body are inseparable. It's real, it's measurable, and it's neuroplastic, which means the brain can rewire itself given the right conditions. The most powerful treatment tools? A strong therapeutic relationship with your doctors, education that validates but empowers, multidisciplinary support, including neurology, psychology, and physical therapy may be appropriate. And as well, when appropriate, taking a mind-body approach to restore function. The earlier the diagnosis, the better the outcome. If you have FND or know someone who does, you're not alone, and you're not broken. You're navigating a condition that lives at the intersection of neurology and psychology, and that takes courage, not shame. Recovery is possible, especially when we shift from asking, "What's wrong with you?" to "What happened to your brain-body connection?" Functional symptoms are real. They deserve real compassion, and real science is finally catching up. If this video helped you understand FND a little better, share it. Drop your story in the comments, and remember, when it comes to the mind and the body, Awareness is healing, and healing is always possible. And be sure to subscribe and hit that notification bell for more videos on the science of mind-body medicine. And let's become more aware together, one step at a time.